Hello, my name is Dr. Alan Buck. I'm a member of Virginia Ear, Nose and Throat Associates. I'm going to introduce you to our video on tympanostomy tubes, or tubes for ear infections. We want to cover the who, what, why, when and wheres of tubes, and in so doing I'm going to introduce you to various members of our practice, physicians and nurses, and hopefully we'll cover their perspective on tubes and hopefully answer all of your questions. But in particular, the indications, pros, cons, and alternatives of tubes. This is Dr. Jim Tyson. He's going to tell us how tubes work.
Children have problems with fluid in their ears and recurrent ear infections because children have poor eustachian tube function. The eustachian tube is a tube that runs from the ear to the back of the nose. That's how we get air behind our eardrums. In children, this tube is very small, and it's hard for them to get air from the nose back up to the middle ear space. The air that's in the middle ear space is constantly reabsorbing slowly into the bloodstream. And as that happens, if you can't get more air up there, you get negative pressure in the middle ear space. That causes fluid to be drawn out from the mucosa into the middle ear space, and that causes two problems. Number one, it's difficult to hear. And number two, the fluid gets recurrently infected. You can treat the infection with antibiotics, and they're very effective at doing one thing. They kill bacteria. They don't make the eustachian tube work any better. Only time does. With growth and development, eustachian tube function naturally improves, and children outgrow this problem. However, in the meantime, we would like them to be able to hear to help with speech and language acquisition, and we don't like them to have infections all the time. So if we put a fake tube in the middle ear, through the eardrum, that bypasses the poorly functioning tube, and they have far fewer problems.
Dr. Dan Van Himbergen. So, Dan, tell us the indications for tubes in children.
Well, there's two primary reasons we put tubes in children's ears. One's for recurrent ear infections, and the other is for persistent ear fluid that's causing hearing loss and not going away. So in 6 months, if a child has 3 infections or more with persistent fluid, that's an indication for tubes, or 4 or more in a year. And also, if a child has fluid in both ears that's causing documented hearing loss that's not clearing up in 3 months or more, then that's another indication we'll put tubes in a child's ear.
This is Dr. Jamie May. Dr. May, what is a tube?
A tube is a small little device made out of various plastics or silicone that is placed into the eardrum and used to maintain a hole within it. They're approximately the size of a peppercorn, and the way that they're placed and the way the eardrum grows around them, they don't interfere with the transmission of sound into the ear.
This is Dr. Thomas Robertson. He's going to tell us about the procedure of placing tympanostomy tubes.
Well, placing the tympanostomy tubes is really a very simple procedure and very straightforward. In adults, we'll do it right here in the office. But for the little ones, they wouldn't really tolerate that, so that's why we're in the operating room under a little anesthesia. Very simply, we are going to look at the ear under the microscope and really visualize that eardrum well. If there's wax in the ear, we'll have to clean that out first. Then once the eardrum is visualized, we can make a very small incision through the fibers of the eardrum just to get the fluid out of the middle ear, and then the tube slips right in. Very, very easy. Once the tube's in, a few drops go in the ear to prevent any blockage of the eardrum, of the ear tubes themselves, and then we turn the gas off and wake the kids up. Maybe about 5 to 10 minutes.
Dr. Robert Brager. He's going to answer the question, what is an ear infection?
When people get ear infections, you think of 3 parts of the ear: the outer ear, the middle ear, and the inner ear. When we are dealing with babies and toddlers, young children, we are talking about infections of the middle ear, the part right here. This area right here is the middle ear that unfortunately is the site of most pediatric ear infections. Ear infections usually start with development of fluid and mucus in this area, and when it doesn't evaporate or get out naturally through the eustachian tube, it can become an infection. When it becomes an infection, it has to be treated when it causes symptoms of significance. When the infections become frequent, when they do not respond to antibiotics, they can sometimes benefit from the procedure called ear tube insertion, which is seen right here. The ear tube allows the fluid in the middle ear that's built up right here to get out, and the infection can drain out and allows air to get in. That is how the tube works.
Thank you, Rob.
All right.
This is Dr. Peter Rigby, our otologist. He's going to talk to us about aftercare of tubes. Thank you.
So you have just had your tubes placed with your ENT doctor, and you're on your way home. They've given you a lot of information, a lot of things to think about. The things that I would think are the most important to start with are that your child has just had anesthesia, so they will generally be cranky that day and they'll regulate themselves the next day. They've had some tubes as well as some drops in their ears. They'll have some cotton balls that you can remove when you get home. The tubes are actually going to remain for in the order of 6 months to a year. In the early aftercare, they're going to assign you some ear drops to use, and generally it's for several days afterwards, usually 4 drops 2 times a day. As far as what you would expect, you may see some drainage from the ear. If drainage could even look bloody and purulent, that is something that is related to the fact that the infection now has a pathway to come out, and the drops are actually helping that process to occur. So I would not panic about drainage. If the drainage does last more than 5 to 7 days, give your doctor a call. They may change the drops, or they may have you come in and clean the ears. The other things to think about is trying to keep water out of your ears. For the first 4 weeks, the tubes are a little bit loose, and as time goes on, the eardrum heals down around the tubes, and the tubes become more firm in the ears. After 4 weeks, most children can swim as long as the water is clean, like pool water. But if you're swimming in a lake or a river, you still would want to wear earplugs. As time goes on, those tubes will continue to move in the eardrum, actually along the eardrum. The eardrum grows from the center outward, and the tube will eventually get to the edge of the eardrum and then fall out. That time frame is usually about 6 months to a year. Once they fall out, then as long as there's not a recurrence of ear infections, that's all that needs to be done. Your doctor would look at those ears about every 6 months until both tubes have gone their way. Early in the tube's life, they may get plugged. So if the tubes do become plugged, you would want there are certain maneuvers your doctor can do to unplug the tubes, including a round of ear drops and all. Symptoms that the ears would get plugged are if your child appears to be having another ear infection. And so that's something where you'd want to see the pediatrician or your ENT to validate that, and then if the tubes were plugged, they would work to try to unplug them. Eventually those tubes do fall out. Sometimes they fall out too soon and you would need another set of tubes. About 20% of the time, children need more than one set of tubes. Sometimes they can stay too long. If they stay longer than 2 years, we generally recommend taking them out and patching the area where the tube was. Again, that's a procedure that usually lasts about 5 to 10 minutes. You go home the same day. Children are generally cranky for the anesthesia, and then they become their regular selves the next day. Sometimes when the tubes fall out, that hole may not close all the way. And if that's the case, there are various procedures we can do to try to patch that. That patch may be as simple as a piece of paper, and more complex, using the child's own tissue to encourage the area of the eardrum to heal. Sometimes a little bit of skin of the eardrum can actually work its way behind the ear, and that can become a bigger problem. If that was the case, either the pediatrician or the ENT doctor would recognize this, and there are procedures that we do if that were to occur as well. And that's something that that's one of the reasons we look at the ears over time. All right, thank you.
This is Dr. Nick Tarasidis. He's going to talk to us about tubes and the conversation we have with families when they're on the fence about tubes.
The main issue that I like to emphasize to parents who are on the fence is not just preventing the complications that are associated with chronic ongoing infections, which can be quite extensive, and I'm not going to elaborate in this discussion because they can be quite numerous and quite actually scary. What I do emphasize is, and often overlooked, is the downside of not placing tubes and thus eliminating the fluid and the infection from behind the eardrum. That fluid and infection causes the child to have a hearing loss. Not a hearing loss with a capital H, but a hearing loss with a little h, suggesting that simply sound cannot pass through a fluid barrier, very similar to screaming at your young child as he's swimming under the surface of the water. the sound in your voice is dampened. Now, what can that cause going forward? Certainly that can affect speech and language development, intellectual development, and that is why I think it's just as important to intervene at that point. Now, there are learning disabilities that occur that are multifactorial and not necessarily related to hearing loss. But certainly, if I can propose a safe, effective procedure to at least take that issue off the table, then I believe it is worthwhile. So instead of trying to convince them to do tubes, I try to explain to them why it's important to proceed with tubes and what are the downsides associated with not eliminating fluid, infection, and hearing loss.
Thank you, Dr. Terracines. This is Dr. Jin Lim. He's going to tell us when and why we consider tubes for a second time and when we consider adding in an adenoidectomy.
Well, obviously, we consider a second set of tubes, especially in children who had a first set, and as soon as the tubes have fallen out and they start getting ear infections again. The other occasion we consider a second set of tubes, especially taking the adenoids out along with it, is to children who continue to have drainage every time they catch a cold with the tube functioning properly. The adenoidectomy is based on a study done many years ago that demonstrated that children who got both the tubes and adenoids done did significantly better in terms of decreasing number of infections, as well as not needing yet another second set of tubes, a third set of tubes at that point. And also, those children were also noted to be significantly healthier in terms of respiratory problems, such as having reduced incidence of sinus infection, croup, bronchitis, pneumonia, and such. That's why we consider highly taking the adenoids out, especially if we return back to the operating room to do yet another set of tubes.
Thank you, Dr. Lim.
But Braga, Rob, why are tubes awesome?
Tubes are awesome because they allow the ear to work. They allow air to get in and fluid to get out, and they allow this thing to finally work, the eustachian tube.
This is Kathy Forney, one of our nurses, and she's going to give us her perspective on tubes.
Hi, I've worked here for about 25 years, and in those years I've seen a lot of little children come through the front door with ear infections, and they have a lot of ear infections and a lot of fluid builds up behind the eardrum, which causes them not to be able to hear very well, and they tend to talk muffled. Then when they have those tubes put in, I get calls the next day or the next few days from their parents talking about how well they're talking, how clear they're talking, and that their children are talking in sentences, which they hadn't been doing. But now that's a nurse's point of view, and I want to give you a mom's point of view. When my little boy, when he was little, what happened is that he had tubes in. He had a lot of ear infections. His first set fell out, and his second set he got in about 3.5 years. The day after he had his tubes put in, we were out back in the backyard playing, and he stops and he has this little puzzled look on his face. And he says, "Mommy, what is that?" And I couldn't figure out quite what he was talking about. And it suddenly dawned on me, and I went down on my knees with tears in my eyes, and I hugged him, and I said, "Honey, those are the birds chirping." I said, "They're telling you good morning." My little boy had never heard those birds chirping. Now, I think tubes are wonderful. And if you're any man, woman, or child that is being told that you need tubes in, I suggest that you get them in, because then maybe someday you can hear those birds too.
Thank you, Kathy.
So Dan, tell us why you think tubes are awesome.
So tubes are great because they really help eliminate the need for antibiotics in young children. Recurrent ear infections are common in pediatric patients, and for kids that we can eliminate the need for recurrent antibiotics and help limit the prevalence of antibiotic resistance, it's really important for patients. It can also be very beneficial in improving speech development because persistent fluid behind the eardrum can lead to hearing loss in young children. And so by limiting that, we can really further develop speech, which is very important as a child develops.
You're clearly a fan of tubes then, aren't you?
Yes, very much.
Excellent.
I hope you found these videos informative. If you need to delve into this subject a little more, you can contact us on our telephone number, which is 804-484-3700, or online at virginiaent.com. Thank you.